Hi Sandy, it's Brandon, and I was just showing you my presentation I did for the Affordable Care Act by President Obama and how it attempts to increase access to care. Whoa, sorry about that. Skip some slides. So first off is the concept of access. Access is a major concern in healthcare policy and in one word that's very often used. So I wanted to define access for you, and that is the ability and the right to approach, enter or exit, or communicate with or make use of something. So in this concept it would be the ability to do all those things with healthcare. Much has changed in medicine and delivery of healthcare today, like technology, understanding of the diseases, and ability to diagnose and treat those diseases. That affects our ability to have access to healthcare. Back in 1981, these two people, Penchensky and Thomas, grouped the characteristics into 5 areas that all started with A. Those areas are, skipped one again. Affordability, availability, accessibility, accommodation, and acceptability. So first off is affordability is determined by how the provider's charges relate to the client's ability and willingness to pay for the services. So obviously we want to be able to afford the services provided by physicians and mid-level providers like PAs and nurse practitioners. We want to be able to make sure that it's accessible because of the cost. Next up is availability, and that's the extent to which the provider has the required resources, like the personnel and technology. And that's one of the things that Obama has also talked about, making sure that there's enough support staff like nurses. Next is accessibility, and that refers to the geographic accessibility that determines how easy a client can reach a provider's location. That has to do with making sure that there's enough clinics in the areas, urgent care clinics, primary care, specialty clinics, outreach facilities. And then there's accommodation, and that's the extent to which the provider's operation is organized in ways that meet the preferences of the client. Just want to make sure that everything is accommodating to them. And acceptability, that's the extent to which the client is comfortable with the characteristics of the provider. So we want to make sure that that is acceptable in both ways, that the patient and the provider are both comfortable with the care provided. Obama signed this Affordable Care Act in March 23rd of 2010, and it's set to roll out. Some has started now, but a lot of it's going to go over the next 4 years, and most changes will take place in 2014. And one thing I thought was interesting that I found in my research was that a claim that United States is on the verge of the most significant change to our healthcare system since the introduction of Medicare in 1965. And thanks to this act, 2.5 million more young adults have health insurance coverage in 2011 than they did in 2010. So here's a little video I found of President Obama talking to the American citizens. Where'd it go? It's not loading.
There are a set of begin to take into effect this year, so I want to talk about this. This year, millions of small business owners will be eligible for tax credits that will help them cover the cost of insurance for their employees. Starting this year, tens of thousands of uninsured Americans with a pre-existing condition and parents whose children have a pre-existing condition will finally be able to purchase the coverage they need. This year, insurance companies will no longer be able to drop people's coverage when they get sick, or place lifetime limits or restrictive annual limits on the amount of care they can receive. This year, all new insurance plans will be required to offer free preventive care. And by the way, for all the students who are here today, starting this year, if you don't have insurance, or if you're about to graduate and you're not sure what your next job's going to be, or there's a little gap between getting that job with insurance, all new plans and some current ones will allow you to stay on your parents' insurance policy until you're 26 years old, starting this year. Because as you start your lives and your careers, the last thing you should worry about is whether you go broke just because you get sick. This year, for the seniors who are in the audience, if you fall in the coverage gap known as the donut hole, you're going to receive $250 to help pay for prescriptions, which will be the first step towards closing that donut hole, that gap, completely. I want seniors to know that despite what some have said, these reforms will not cut your guaranteed benefits. In fact, under this law, Americans on Medicare will receive free preventive care without co-payments and deductibles. From creating jobs to reducing deficits to making sure every child has a decent education, we still face enormous challenges in this country. As we meet those challenges, we're going to face more resistance. We're going to face more doubt. We're going to face more cynicism. We're going to hear more voices who will warn us that we're reaching too far, that we're going too fast. Who are going to tell us that we can't wait. Who are going to just make wild accusations about what we're trying to do. And when that happens, we've got to remember the promise that we've already fulfilled, and the people who fulfilled it, and the generations before us who made it possible. We're going to have to respond with the creed that continues to define the character of this country we love. And it's my favorite memory island. That creed that says, yes, we can.
So some of the benefits of the Affordable Care Act are decreasing the rising cost of health care. Enrollees in the program will see improvements in their coverage. This can be either one of two things or both, either a better price for their coverage or more adequate coverage, or possibly both of those things. And small businesses will benefit from lower prices and a wider variety of health plans to choose from. And employers will have a small business tax credit. The large businesses, the employees of the large businesses will benefit from shifting their monies from expensive insurances to increased wages, and that would benefit the economy, having people with higher paying jobs, and this will also help with cost control. And lastly, I wanted to look at the opposite side of the fact that a lot of people think that Obamacare, as it's commonly called, is a joke. So here's another video I found on YouTube. Who knows? Video go.
Recently, when I fell down the stairs, I was able to summon the Health Advisory Committee by government-assigned doctor, the White House. Recently, when I fell down the stairs, I was able to summon the Health Advisory Committee by
technical difficulties.
An acorn without picking up a telephone. I used this remote control to contact Obamacare, government-assigned doctor, the White House, response service, without pressing this button and speaking to the air. I used this remote control to contact Obamacare, my 24-hour emergency response service. Just press this button and speak into the air. Falling down, and I can't get back up.
Thank you for calling Obamacare. All of our representatives are busy providing quality health care.
I've fallen down, and I can't get back up. By
Thank you for calling
Obamacare, you can
Obamacare.
get complete free coverage provided by your grandchildren and their children. Protect yourself with the government is here to help Obamacare. For more information, you can get complete free coverage provided by your grandchildren and their children. The government is here to help. Contact our call center at 202-224-3542. Remember, no one cares like Obamacare. For more information, call now. Contact our call center at 202-224-3542. Remember, no one cares like Obamacare. Call now.
For free information.
Sorry for the technical difficulty, but obviously you can see there's a lot of people that oppose Obamacare and say that it's going to increase the cost and increase the burden on the coming generations. And all we really know is that we have to wait and see what happens, whether costs will rise or as they have continued to do so, or whether they will decrease, and whether access to health care will increase or decrease or maybe stay the same. So I guess we'll stay tuned and see. Thanks, bye.